Good afternoon, everyone. My name is Christine Pisani. I'm the Executive Director of the Council on Developmental Disabilities. And just briefly, for those of you who may not know, the Council is made up of people with intellectual and developmental disabilities, as well as family members, service providers, and specific state agency representatives. And our role is federally and state mandated to advocate for the best practice of people with intellectual and developmental disabilities and families. And that is really guided and informed by people with disabilities and families leading. And so we work real hard to provide those opportunities so that people with disabilities and families can lead to shape our service system. I am really pleased to be here today with Jeremy Maxson, with Link, and David Lehman, and I'll turn it to them to introduce themselves.
I'll go. My name is David Lehman. I'm a lobbyist in the state of Idaho. I represent a couple different organizations, the Idaho Association of Community Providers and the Idaho Association of Home Care Agencies in this space. I do a lot of other work in healthcare and with Medicaid. Prior to that, I was the policy director and health policy advisor for Governor Kempthorne. So it's a long time ago, but have some experience both on the executive branch side and as a representative for agency or organizations who are before the legislature and the executive as well. I'm happy to be here.
And I'm Jeremy Maxson. I'm the executive director of Link, Living Independence Network Corporation, and Link is a regional nonprofit center for independent living, and our mission is to empower folks in Idaho with disabilities to live the life of our choosing. We're a organization that is governed by folks with disabilities and largely staffed by folks with disabilities, and we have a wide array of services and programs that stretch across about 30,000 square miles of southern Idaho, from McCall down to Owyhee County, over to Twin Falls County, up to Blaine and back to Boise. So we run a self-directed home and community-based services in-home care program, and have been involved in the issue around the direct care workforce stuff. So really, really excited to be here and to connect with everyone and share some information on what's been going on with direct care issues.
So today we're going to be talking about a coalition that we initiated last spring called the Our Care Can't Wait Coalition. This is specifically related to the direct care workforce. And just personally, I am a caregiver to and guardian and conservator for my 80-year-old mother who unfortunately has dementia. And so understand the crisis with direct care workers and the lack of direct care workers, and how stressful this is for caregivers, for family members, and for the people needing support. So we're really pleased to talk with you today about the coalition, and really want to make sure that if you have specific questions, please don't be shy. We really are guided by the comments and lived experience of people with disabilities and families. So please don't be shy if you have comments or questions. The coalition, let me move the slide, is made up of state home and community-based service providers, as well as participants in the system, families and people with disabilities, different advocacy organizations. So for example, Jeremy's organization, Link, an independent living center. We have all the independent living centers involved. We have David representing the Idaho Association of Community Providers, represented, as well as a number of different types of providers in the home and community-based service system here in Idaho. We have families, we have people with disabilities, we have the Center on Disabilities and Human Development involved, Disability Rights Idaho, of course, the council. So it's quite a coalition, and we are specifically working on recommendations from the 2023 Office of Performance Evaluations report called the Sustainability of the Direct Care Workforce. And I want to stop right there because I want to make sure that if people on the call, I don't want to assume that people understand what I mean by home and community-based services. So I want to stop and check for understanding about that. And then also to see if there is anyone who wasn't aware of this report that came out in 2023. Okay, so I'm gonna assume everyone is up to speed about what we're talking about. And so one thing that I will say about the coalition is that we went all in as a coalition to try to do whatever we could, investing a lot of resources, both staff and financially, investing in the work of trying to implement recommendations to help us resolve this crisis. For the current numbers that we have are 24,791 children with disabilities, 17,904 adults with disabilities, and 27,941 seniors through the coordinated Medicare and Medicaid plan, who all rely on this direct care workforce in our home and community-based services. Just for information, in case people did have questions, home and community-based services are really designed to go into the homes of people with disabilities and seniors to help them with whatever types of support they may need to live independently in their home. They also are designed to help people in the community, to access the community, to access going to the grocery store, getting to medical appointments, learning skills in the community to become independent in the community. And this is really the only place where people with disabilities and seniors can access long-term services and supports to be able to live in their homes and communities, because as most of you know, private insurance is not, that's not an option through private insurance. Also, home and community-based services are designed to meet individualized needs so that we can avoid more high-cost institutional living like a nursing home. There were three specific recommendations from the Office of Performance Evaluation report that the coalition has really been focusing on. There were 5 total recommendations, but we decided that we were going to focus on those 3 recommendations that had specific relationship to Medicaid and our ability to influence those. So the first recommendation is that Medicaid rates should support competitive wages to achieve a sustainable workforce. And David's going to speak to specific rate increases that were proposed in the legislature this year and give you an update on that, on the status of those. But we believe that, and it was stated very clearly in the report, that rates have just not kept up with inflation. Many, as you know, certified family homes went over 20 years without a rate increase. And unfortunately, we have a number of service provider categories within home and community-based services who have not seen a rate increase for many years. So in many ways, we're really playing catch up for a lack of funding services for far too long. So we're very much interested in seeing rate increases happen on a more regular basis than waiting several years to see a rate increase. Sorry, I skipped ahead. Oops. The second recommendation that was made in the Office of Performance Evaluation report was that the Department of Health and Welfare should support efforts to make training more accessible, and develop a career ladder for direct care workers. And this was something that the council and the Center on Disabilities and Human Development have worked on for about 5 years to come up with a whole set of recommendations around what training needs to be provided to direct care workers in home and community-based services, and how to develop a career ladder. And those recommendations were provided to the Division of Medicaid about a year ago. And related to the next recommendation, Medicaid must improve its capacity to manage a program of its size and complexity. Basically, Medicaid not having enough staff. So when we presented those recommendations about training for direct care workers, we were told by Medicaid staff, these are really great, but we can't do anything with them because we don't have the staffing to implement them. And this is not the first time that we have heard this. We hear this quite a bit with the Division of Medicaid, that they just lack the people to be able to do the work of implementing all kinds of different types of recommendations. I think this is you, Jeremy.
Thank you, Christine. Yeah, so we, once right at the end of the legislative session last year, the Office of Performance Evaluation report was released. There was a little bit of back and forth, some internal politics going on amongst the legislature, and that report had been issued but not actually released by the Joint Legislative Oversight Committee. It was eventually released, and it did a really good job, like Christine said, kind of summarizing what the issue is facing home and community-based services and folks needing in-home care and access to direct care workers. And what we did as a coalition is pretty quickly begin to formulate a plan on different activities around education and advocacy to lay the groundwork for this legislative session to advocate for those recommendations. There was a whole bunch of great collaboration that went on, a lot of coordination at different events. Organizations were putting things on independently, but in coordination to amplify our collective efforts to build some power and have some influence over the implementation of the recommendations. There were a number of lunch and learn events that were put on, and those were opportunities for folks with disabilities to show up and learn a little bit deeper information on the nuts and bolts of home and community-based services, what the OPE recommendations were, and how to best advocate, storytell, things like that when it comes to talking with lawmakers. There were a number of those events that happened around the state. There were presentations to the Medicaid Managed Care Task Force, as many of you know. Several years ago, I think there was a shift to value-based care, but during the pandemic and coming out of the pandemic, there has been this kind of chatter about managed care. And I think, David, you were presenting at the Managed Care Task Force, and there were another center director, Michael Lefevre, and others presented there to couch this kind of our issues with direct care in the context of Medicaid managed care. There were some really incredibly powerful presentations to the Joint Legislative Oversight Committee. Noel Garcia, which I know some of you know, shared his story of how his lack of access to direct care had been impacting and continues to impact his life. For those of you who were not there, that was probably one of the most powerful testimonies I have seen in front of one of those committees, and the impact on the legislators across both sides of the aisle was pretty profound. I don't know that there was a dry eye in the room, and it was remarkable to see the impact that Noel's story had on those decision makers. There was also a story from a gentleman that our center has worked with who's in a nursing facility with ALS, and ended up in that nursing facility in large part because of a lack of access to direct care workers during the pandemic. There were a number of legislative advocacy trainings, and there was a legislative luncheon that was put on where lawmakers were invited to hear presentations from the Office of Performance Evaluation, as well as some experts from out of state who are familiar with home and community-based services. And then as we approach the legislative session, our organization with other organizations, other partners, had our second annual Operation Advocacy, which was focused on the direct care workforce issues. So we held a one-day training that had about 67 people, and then coincided that training with Fred Rigger's Disability Awareness Day, which is sponsored by the Idaho Consortium of Idahoans with Disabilities. And so along with Operation Advocacy and the council and other groups, there were a ton of people down at the Capitol, not just this year, but last year as well. It was pretty amazing to be in the Capitol, and every room you went into, every hallway, every corner, there were people with disabilities and caregivers and advocates meeting with lawmakers. And so it was a really powerful experience. And if you have not been down there for Disability Awareness Day and participated in those education and advocacy activities, look for those during the next legislative session, and come down and join us in doing that. It's a really powerful experience. And that has been in addition to all the other work that organizations have to do just to keep everything running, at agencies like Christine's and at centers like the one that I work for, we had a huge amount of work going